Hi, everybody. Welcome and good afternoon. My name is Christine Mehta. I'm the senior editor at Harvard Public Health Magazine, and I'm very pleased to be here in the Harvard Chan studio with Carlos Alvarado Quesada, the 48th president of the Republic of Costa Rica. We are also delighted that his wife, Claudia Dobles Camargo, is able to join us here in the audience today. This event is also presented jointly by Harvard Public Health and the studio at Harvard Chan. Here at the Harvard School of Public Health, we've previously covered Costa Rica's incredible public health successes over the past 2 decades. For example, investments in healthcare, education, and infrastructure have resulted in a life expectancy of 80.2 years, one of the highest in the region, and longer than life expectancy in the United States, which has dropped for 2 consecutive years to just 76 years old in 2021. Today, we're going to continue that conversation by focusing on highlights from President Alvarado's time in office from 2018 to 2022, when he governed through the first difficult years of the pandemic. Costa Rica's pandemic response was globally applauded for its effectiveness, with the country reporting the lowest case fatality rates in the region for the pandemic's first year. President Alvarado's administration also announced the country would make significant investments in decarbonization, making it the first country to announce that it would be completely carbon neutral by 2050. The government has also made progress towards this goal, including promoting renewable energy, sustainable agriculture, and reforestation. In this conversation, we'll talk more about the example that Costa Rica is setting for the rest of the world when it comes to climate change, health, and global leadership. So President Alvarado, again, welcome. Thank you so much for being here. Let's start with COVID-19. So in March 2020, you were governing through the global pandemic. Walk me through that first week when you first heard about COVID-19 cases being reported in the country.
Well, thank you, Christine, for having me, and thanks to the School of Public Health. And if we go back to 2020, it's like I have 3 sets of memories, and they evolve quite quickly. I remember on January, starting the new year with many ideas for what we were going to do to develop at that time. And I remember in January, my Minister of Communication mentioned to me collaterally, Agustin Castro, he said, "Mr. President, there's a virus outbreak in Asia. We should look at it." He just said that. So I took his advice and I went to my Minister of Health, Daniel Salas, and I said, "Daniel, can you do a presentation on the cabinet meeting?" And he stood there. Coincidentally, he's an expert on epidemiologist. When I hired him, I was not expecting a pandemic. So he went to the board, and he drew a circle with some crowns, and he said it's a coronavirus. Because of the crowns, they call it coronavirus, and we should be aiming at 2 variables: how deadly it could be and how fast it could spread. So those variables will tell how impactful, if there is an outbreak or a pandemic, it will happen. Could be very deadly, but spread too slowly, or it could spread really quickly, but not be deadly. Or it could lie in the middle, he said. So that determines how dangerous it is. So that happened in January, and one action that proved to be right was, as a preventive action and in protocol, the Commission of Emergency of the country with the Ministry of Health and many other partners set a task force to follow up. That happened on late January. That's like the first set of memories. The others come from February, and especially when we start getting the news from China, and later on the news from Italy. So we started to see one image I have in my mind is this massive move of land in China building new hospitals. Or later on, the situation in Italy and in Europe of many hospitals being completely overflowed. And that set of memories came with, I had a late call from the head of the social security system, and from the medics at that time, Mario Ruiz, and he said, "Mr. President, sorry to call you this late, but I was on the phone with some of my colleagues that I studied, and some of them now in Europe, and they say this is very, very complicated. This is really putting to their knees the health system, this is going to be a crisis in Costa Rica. So what we started to see unfold in that way, we knew it was going to be huge. So we needed to reinforce our efforts that we started in January to prepare. And the other memory comes in March, when the pandemic hit, when the first case arrived in the 6th of March. And two sets of memories. My memories is of preparing for the press conference and having Roman Macaya, the head of Social Security, who was a lecturer here in Harvard, telling, rehearsing with me how we were going to, instead of shake hands, say greet with the elbows, because we needed to communicate to the population that something different was coming. And also remembering that all those ideas and dreams and planning of how 2020 was going to be a year to change many things were to put many of them, not all of them, but many on hold, because the focus of our government, and it happened until I left office, was going to be on saving lives and trying to protect the people during that time. So that's how I remember how it started all.
So Costa Rica already had a robust public health system in place. What about that system do you think made Costa Rica's response so successful, especially in the first 6 months to first year of the pandemic?
I do believe that a strong legacy on public health will make the difference. I mean, in our case, you're talking about a system that it's 80 years old, 80. It was founded in 1941. Actually, when I was in office, it turned 80. So this proved to be a legacy of protection for our whole population. We have a strong social security, trained physicians, 23 national hospitals, a couple of hundred of national clinics, thousands of proximity units from the healthcare system, and a strong Ministry of Health that can give guidance to the population and to institutions of what to do and what not to do. So we used that when we started tackling the pandemic in the different levels, from the workers in the field that were in the communities, telling it appears to be the simple things, but the things that matter, washing their hands, keeping the distance, following those advice, to the communities, to the personnel, the physicians, nurses in the hospitals getting ready for the whole situation, and all the personnel of support. So that proved to be critical, having that in place to address the pandemic. But that's having the tool, which is necessary, and also is using the tool, using it following science, following the best information available. And I remember two critical things. One was that also the head of we assembled a big crisis task force, which I was leading, and we had lots of discussions there because it was a multidimensional problem. It was not only a health problem. It had to be with tourism, with education, with the private sector, with municipalities, you name it. So we had this huge task force, and I remember that during the discussions, the head of the health system said, in order to win this, we could not win this in the hospitals. The hospitals are the last resource in saving the lives of the people, but it's not there that we win this battle. We win this battle in the streets. We win this battle recruiting citizens and their awareness as the best tool for protecting all of us. So we went into that direction, and I think that leveraging on the tradition of a successful system and using it with the purpose of protecting people ethically explains a little bit how the response was positive.
So we were speaking a little bit before this conversation this morning, and you had mentioned that Costa Rica never implemented lockdowns during the pandemic. Can you dive a little bit more into that?
Well, that actually was one of the outcomes of that multitask team that we put into place. So we started to gather information that came from the other places, In that regard, we were lucky to have the examples first of Asia, then of Europe, of what measures to implement. So we went into the lockdown discussion because many countries had used the lockdown as a way around it. So we started to see how complex it was, and the idea came from the Ministry of Security and the Ministry of Transportation and myself looking for an alternative instead of lockdowns. Also, we were concerned about the impact in the population, emotional impact. So we said the lockdown is not an objective in itself. The objective is to reduce the mobility, to reduce the spread of the virus. So what we need to aim is to reducing mobility. So with that insight, what we did was we implemented one thing we have been using in the past for the center of the capital, which was a restriction to certain vehicles, certain days to enter. So we implemented a health restriction to vehicles to circulate. So that way, without enforcing a lockdown, we reduce dramatically mobility. So we follow up on the indicators of the mobility, which was one of the factors into the whole forecast of the pandemic. Truth being said, at the beginning of the pandemic, our strategy was to be really hard on these measures, but our strategy was also to gain time because we needed to expand as much as possible our health system. In this case, in terms of the beds for intensive care. So our strategy was to gain time at the beginning, so we have the beds. And that proved to be right because there was not a moment in which a person lacked the service if they need it, if they got really ill with COVID. So the system got like to the top, but never over. I mean, we never said to somebody, we cannot receive you. That was the aim of it. Also knowing that we were fighting the battle, not in the hospitals, but in the streets and with the awareness of the people. But that's how we came along with that measure. And there are other examples of how that multitask team worked. For example, there was a huge need to open to air flight, to reactivate tourism. So the tourism worked with the health system and the insurance company to create a mean to have not only the traceability, but the insurance for people that came. And then we enforced that measure and were the first one to open to flight travel, to start it again. Or with the vaccine. With the multitask team, with the budget and finance, with lawyers and with physicians, we started early to get in contact with the companies that were developing the vaccine and doing an early commitment to have access. So we were the 7th country in the world that received vaccines. But because of that multitask team that was able to work together, collaborating to bring in solutions about the situation.
So how would you summarize Costa Rica's public health system, just in, say, 5 words that would summarize to help people who aren't as familiar with Costa Rica's model of public health, to help them understand exactly how it was so well positioned to address something like the COVID-19 pandemic?
Well, it's a public health system based on the human right of health, so that gives universal access. Is publicly driven and financed about everybody. And with the insight that being health a human right, it should be provided to everyone, everywhere, regardless of their background. That's the huge aspiration of the system, and that's how it was built 80 years ago, with its challenges, not being perfect, but with that aim. So we're proud to say that, for example, whenever somebody needs a very expensive treatment, they might get it through the social health system, or if that's not possible, many people sue the system in the courts and get the access. Or, for example, if somebody needs a transplant, the queue, it's based on the right to that transplant and not the capacity to pay for it necessarily. So, and it's a system based not only on the hospitals, That's another key trait, but on the primary level, on what's called the hospital without walls. That means taking the healthcare and taking the public health to the people in the prevention of disease. A paradigm which not puts in the center the treatment, the disease itself and the hospital, but going to the people in the community and changing behavior, preventive, the things that are cheap and we know of exercise, nutrition, habits, but changing reality there and not working on that side of the queue instead of working on the other side of the queue, which is the hospital. I know that's not 5 words, but that's the best way I can try to explain it briefly.
That was an excellent description. I think we all really appreciate it. So I want to talk a little bit about the U.S. context. What lessons do you think Costa Rica and what you just described about how its public health system is set up, how do you think it translates to other country contexts, understanding obviously that a country like the U.S. and Costa Rica are different when it comes to population, demographics, the healthcare system, but what lessons do you think that Costa Rica can provide to other countries?
Well, I usually am very careful when I discuss the Costa Rican example. I always use the disclaimer that it's not an example you can literally translate to other contexts. I mean, Costa Rica abolished the army. We don't have any armed forces, and we use those resources, we try to use those resources for education, for healthcare, for example. Or we are in the process of decarbonization. We do not want to exploit or extract fossil fuels, but that started 70 years ago. So what Costa Rica represents is a possibility of it's possible to do things differently. In the case of healthcare, how can you explain that a mid-income country that's not as rich as many others can perform in health terms the same way or better in terms of health? So that's the example that it represents. It shows that to perform well in healthcare or in health in general, it not correlates directly on how wealthy your country is. It correlates of how well structured a health and robust a health system is in order to provide. That's the lesson that it demonstrates. When you look at the data on the pandemic and you compare the results, for example, in case of deaths, as a percentage of population, our performance is very similar to the performance of Germany and of Switzerland and of Luxembourg. And we are a country that's not as wealthy. And even our economic rebound is very similar to those countries. Mm-hmm. So it shows that doing the things in a certain way, not necessarily through how wealthy you are, can deliver results for people. So I think that's the insight. How to translate that into specific public policies, that's what different people we need to figure out as part of the policy part, the creativity of policy. Mm-hmm. But I do believe the example shows it is possible. It is possible to do so.
I think that's such a powerful point, given that here in this country, there is quite a bit of correlation between income, wealth, and health outcomes for different groups of Americans. But as we mentioned before this recorded conversation, a lot of that has to do with potentially the way that the healthcare system is set up to predetermine that. So if you were going to look at how the public health system is underpinned in Costa Rica, what kind of values do you think can be translated to a system like the U.S. to bolster what is a smaller public health system that a smaller percentage of Americans interact with?
Well, I think one key trait of the Costa Rican healthcare system has to do with it's based on the human right of health. So that means that it's a right, a universal right. So anyone deserves that right and can appeal or can raise their voice in that regard, regardless of if they are wealthy or not wealthy, because it's a right. So it's built behind that conception, that notion. It's not a it's not that because that you said so it happens. You need to put in place a system that, but a system that stands to that ideal, to that horizon. And given that it's a human right, it's universal. So you have to build it in a way that you fulfill that promise and make it sustainable, and make it has the technical capacity, the financial capacity to deliver that promise. And that's what we have been trying to build for the last 80 years and preserve for the future. We have challenges, for example, being linked to the pension system that in Costa Rica is linked to the healthcare system, in training new physicians, in providing for a population that's growing older. Those are really pressing challenges. But it goes through that vision. The vision from the origin, its principles, its values and conception determines the outcome.
So how is Costa Rica going about tackling challenges like an aging population? How will the public health system adjust?
Well, now we need to work a lot on the financial part of it, or give sustainability, which is challenging because also it means that there are fewer workers financing the structure of the system. So that brings about financial pressures. We are having those discussions on how to make it. On the technical part also, how to which are the best ways to provide the system. But that's why I also emphasize a lot on the different levels of in which the healthcare works, and how important it is to invest on the primary level, on the proximity with the citizen, with people. Because those investments are lower, but the return of those investments, it's way higher. Prevention is going to be way higher than when you actually need to treat people in the hospitals. I mean, you could have there's a saying that the best time to plant a tree was 20 years ago. So we need to start putting those seeds now in order to have that return of the investment, and work in that regard, because I know it from politics. For politics and for communities, sometimes it's very visual and more attractive to have, that big hospital and the new beds and the new equipment, because that gives us a sense of security. But if we work on prevention, which is sometimes less tangible, we might be reducing, in many cases, not all of them, the need of those other more expensive tools. So I think we need to give more value to working with people in the communities, in their proximities, in our habits, in our mental health, not seeing individuals only as a disease in the liver or a disease in the heart, or seeing the whole of what a person involves, not only as what we consume, what we eat, but also the thoughts we consume, the environment we are entangled or that we are within. All those things we need to bring in the conception of health, of how we conceptualize health.
So we'll come back to some of this in the audience portion of the Q&A, but I want to switch gears a little bit and talk about decarbonization. So you made it a cornerstone of your presidency during your time in office to make Costa Rica carbon neutral by 2050. So I wanted to ask, why was that a priority? And how do you think it ties into, for example, health outcomes or economic transformation in the country?
Well, for many reasons. One is that if we don't work on decarbonization, basically there won't be a planet for our children and grandchildren. So there makes no sense to be in office and not work on that. I always, I had that image a lot, but I was, in 2050, when the Paris Agreement puts the goal of decarbonization, my son is going to be basically the age I had when I became president. So I keep asking myself, what is it he going to say about that? And how accountable can I say, okay, Gabriel, I did this and this and that, or I do nothing? So that was always on the back of my mind. We needed to tackle that for the future generations. So that's the basic insight of the decarbonization. And also, as the generation of my grandparents created the health system or the clean and renewable energy system, Costa Rica has 99% of electricity being clean and renewable. I needed to build something of the sort for the future generation. That was my responsibility. So decarbonization is that task. And back in 2019, now we have a discussion of the ongoing efforts of decarbonization. The United States has the Inflation Reduction Act, just approved last year. Is the massive industrial policy to decarbonize the U.S. economy. The European Union has done similarly, even China and India as well. But in 2019, nobody was committing to that.
Right.
So we were the first ones to say this is the way about it. And that eventually proved to us many positive things. The decarbonization that we proposed, the model of decarbonization, is being used by others now to start their decarbonization. So to those critics that said that Costa Rica is too small, that's not going to impact, we did not impact the scale necessarily for our size, but we impact the scale because of the example the other follows. That's what we call the hummingbird effect. The hummingbird that shows the way, it's very small, but then the others big follow, and that's has happened in this case. Similar, one part has to do with the conservation, and we launched the goal of protecting 30% of the ocean and 30% of the land by 2030. Costa Rica led that with France and the UK in 2019. And everybody said, it's impossible, it's not going to happen, it's too ambitious. But that alliance we created in 2019 made it happen in 2022, December, in Montreal, in the COP of Biodiversity, that 190 countries committed to the 30 by 30 goal. That means that 190 countries, large, small, and medium, are going to protect 30% of their ocean and 30% of their land. And that's going to make a difference in the world to come. So that's what's relevant of decarbonization. It has huge challenges. I won't say it's just a honky-dory ride. Many countries in the developing world are net exporters of fossil fuels. And if you do the transition without diversifying those economies, you might end up in a decarbonized world with huge differences and huge injustice. But understanding that we need to decarbonize, we need to then embrace the task of a just energy transition with diversification. And I think that's the next step after a decarbonization has to be the clarity of a just energy transition for the world. If not, we might end decarbonize with a very unjust world.
That's a good segue into talking a little bit about global cooperation and the role that Costa Rica is playing in things like decarbonization, public health lessons for the rest of the world. What role do you see Costa Rica and other states in general playing in, say, future negotiations around something like the pandemic treaty, around new international treaties that will come up to start to negotiate around some of these big questions that are affecting the world right now?
Well, there was one of my predecessors, the great Jose Figueres, the gentleman that abolished the army. He used to say that Costa Rica, it's like a laboratory. And that could be because of the scale. So you can manage to do things like abolishing the army, or creating an electric grid that's clean and renewable, or creating a healthcare system that's universal. It's because it's a smaller scale, and you can do things like in a lab. Actually, we upfront proposed Costa Rica as a lab for decarbonization. Because those things, today you can plug electric vehicles in Costa Rica, that our grid is clean and renewable, so you actually have net zero electric vehicles. In other places, you can plug an electric vehicle with a dirty, not renewable electricity, you end up basically in the same place. So that being said, there's that possibility to push for change, and I think we need to do so. During the pandemic, and when I speak with people from the scientific community, especially young people, people ask me if there is hope for the efforts of science and what after the pandemic. And I said, sure, science delivered. Going back to the beginning of the pandemic, in March, we knew there was a pandemic. And in December that same year, we have delivered a vaccine that was thought to be impossible. The development of a vaccine in less than 1 year. That being said, science delivered. But that being said, it was not science that not make it available to everyone in every part of the world.
Right.
That has to do more with politics. That has to do more with international or multilateral inequality. Mm-hmm. And those are the things that I believe we need to tackle diplomatically, bringing examples of how we need to change the system. So if we have a development as a vaccine in less than 1 year that holds the promise of a more equitable world through knowledge, science, and goodwill of people, that can be available for everyone at the same time. So that the other part of the equation we need to fix.
So I want to close. We have some questions that we solicited from the audience ahead of time. So I want to give the last word to one of those questions from Tamana Shin. Why did Costa Rica decide to take a leadership role in the COVID-19 Technology Access Pool, or CTAP, which is a WHO program that seeks to develop a single global platform for development of diagnostics, vaccines, and therapeutics, where innovators commit to sharing their intellectual property and license their patents to qualified manufacturers? Additionally, he would appreciate any insights on the political challenges with stakeholders within your country in the leadership role of CTAP.
So CTAP was launched in May of 2020, just at the beginning of the pandemic. And we proposed CTAP to Dr. Tedros of the World Health Organization, and together we launched it. And it was a call, it was that trying to fix that part of the equation of the world. It was a call for everybody to put their best technology there, available for whoever needs it. It was a voluntary, free repository of technology. So if people had something that made a difference, they could put it there for everyone to access. It was a call that at the beginning got 40 countries to support it. Again, lots of people saying it's impossible, greed is going to win this battle. But eventually, first Spain and one of their main labs became part of the initiative, and eventually the United States became part of the initiative, putting some developments to access to everybody. So what it demonstrated is that it's possible to do so. It's possible to do that. Regardless to some people, so I say it's impossible. Others were critics saying that will halt innovation. I don't think necessarily is the case. It might change the way you get paid for innovation. And to some extent might change, yes, how much reach you can get in the process. But again, it's thinking from a perspective of a right perspective in a world that's better off if we all are better off. I think we're missing in the picture that I can become very wealthy, but if the world around me is in crisis and it's in pain, eventually that pain is going to come to me, like because of physics. That's going to affect. There's no wall I can build around me that's going to protect me indefinitely. One of the things that concerns me about the pandemic that they also show one side of humanity is what. There were some politicians knowing the science that did enforce certain policies for their own benefit, popularity, or understanding that meant that more people were going to die. And that ethically is there. That will also happen during the pandemic. So I think we need to be mindful of that. But there's also, luckily, those examples of, for example, the people that developed the vaccine, the people that fought to make it available everywhere, the health workers. I mean, there's also those examples that demonstrate that, yes, the CTAP or the 30 by 30. It is possible that if people come together for a greater good, it can happen. It can happen. So I draw hope from there. We're not living in a full of hopelessness. No. Change is possible, and there are examples that are possible, and the good fight is out there to achieve those.
Well, President Alvarado, I think that's an excellent place to close. Thank you all for joining us in the studio and online. A warm thank you again to our guest, President Alvarado of Costa Rica. And for our online audience, we'll see you at the next event.